Hi, my name is Kristen Halla, and today we will be talking about long-term care pharmacy. The objectives for today's presentation include being able to describe what long-term care and long-term care pharmacy are. Next, being able to identify different settings pharmacists can work in to provide long-term care pharmacy services. The last thing I'd like you to be able to do is recognize different things that long-term care pharmacists do. So to start off, let's talk about what is long-term care. Per the National Institute on Aging, long-term care involves a variety of services designed to meet a person's health or personal care needs during a short or long period of time. These services help people live as independently and safely as possible when they can't perform their daily activities on their own any longer. Long-term care can be provided in a variety of places by a variety of people, and it is all really dependent on what someone may or may not need. Long-term care can be provided by a variety of people as well. It may be things like family members or even friends, and often there's no compensation that is involved. Some other settings where patients might be in a nursing home or even a community center. A lot of the time, long-term care is there to provide personal basic care needs, such as helping them with something called activities of daily living, or ADLs. These things include things such as bathing or showering, helping people go to the bathroom, helping people get dressed, helping people eat, etc. Sometimes, depending on the setting that a patient may be living in for long-term care, different meals and or transportation may be provided to them. Also, long-term care can be used for people with a variety of different things going on with them. For example, it can be for people with a variety of different disease states. It can be potentially for if people have different disabilities. And it may just be used for people as they start to age and get older. Now that we know what long-term care is, now let's talk about what long-term care pharmacy is. It can be described as a pharmacy owned by or under contract with a long-term care facility to provide prescription drugs to the facility's residents. What's something to be aware of with long-term care pharmacy is that it isn't like a retail pharmacy. People typically can't walk up to the window of a long-care pharmacy. They're not open to the public, and they're typically not there to sell a bunch of different products. Long-term care pharmacies may be something that more is like a warehouse. They're not usually open to the public, and patients typically don't have direct access to them. They're usually created so they can produce large volumes of prescriptions and distribute in a very specific manner. In these type of roles, there's usually, in a long-term care pharmacy, a lot of dispensing that's going on, and a lot of patient-specific medication compounding can be done as well. Staff in these settings must be oriented for how to use different resources and different technologies to be able to provide care to the different long-term care facilities they may be serving. All right, now that we've got that background, let's try to figure out what a pharmacist in a long-term care pharmacy setting may do. A long-term care pharmacist is typically working for a long-term care pharmacy or in the long-term care pharmacy setting to provide different pharmacy services such as infusion, education, consulting, or different pharmacy-related services depending on the patient population that they're looking to serve. A pharmacist in this setting can have two different career pathways along the way. One can either be working actually in the long-term care pharmacy, working to dispense and manage different medications in that setting, or a pharmacist in this setting could be working to provide consultant services. Sometimes pharmacists in these roles, depending where they're working for, they may actually jump back and forth between the consultant and the dispensing type role, again, just depending where they work. So where do we find pharmacists in these settings working? I already mentioned they may be working actually at the long-term care pharmacy, helping provide the prescriptions to facilities. On the flip side, if they're working for the consultant job, they may actually be working in different skilled nursing facilities. They may be working in a nursing home. They may be working at a rehab center or even an independent consultant, just working on their own and providing services for some of these different long-term care settings. long-term care pharmacists do as well. A variety of different things pharmacists in this setting can do. Again, it really just depends where they're working and what type of role in the long-term care pharmacy setting they're doing. If pharmacists are working in long-term care pharmacy, they may be working to assess different medication doses. They may be looking at different medication interactions. They may be assessing drug therapy regimens to see if they're appropriate or not for patients. And they may be helping with different formulary decisions to help with the different populations that they're working to manage. Pharmacists also in this setting also may have greater interaction with a lot of the aging or elderly population, because a lot of people living in these different long-term care settings are older. So a lot of times pharmacists in this setting might have more specificities or certifications for these roles. Although long-term care pharmacists are often working with this older or geriatric population, they also may be working with other specialized disease states, such as non-geriatric patients, such as patients with disease states like HIV, multiple sclerosis, ALS, or potentially some different disability patients. If a pharmacist isn't working in a long-term care pharmacy itself, they might be in that consultant role. Pharmacists that work in that consultant role might be also working to be assessing different medications. However, they might be doing this through doing different medication chart reviews through the facilities. In that setting, as they review different medications and the patient's medical history, they might be providing different recommendations to the healthcare team to try to improve a patient's care in those settings. Often an example I like to think about is a patient in a geriatric patient. A pharmacist may come in and do a review and actually look at ways that we can try to de-prescribe medications, because often as the patient's getting older, they get put on so many medications over time, and this can be a great time for a consultant pharmacist to come in and give different recommendations for how to get rid of some of the medications a patient may not need anymore. I'd like to talk about some characteristics that a long-term care pharmacist may have. This is actually a survey that I pulled some of this information from a 2007 American Pharmacists Association Career Pathway Evaluation Program. It looked at people that were working in long-term care, and they actually found that beyond the PharmD, 12% actually had advanced degrees in addition to their PharmD, so things such as their MBA, PhD, etc. Also in this survey, they found that 42% of people had some type of certificate training. So they went beyond what their already pharmacist training had, and they got additional certifications to become more specialized in that long-term care setting, such as getting a geriatric certification. Also at this time, they had found that 24% of people had some type of residency training. What may be interesting is if a survey like this was done in today's numbers, we'd probably find that even more people had residency training. Also at this time of the survey, they found that a majority of people that worked in the setting were female. From the same survey, they interviewed these different long-term care pharmacists. And just to note, these pharmacists were both pharmacists working in long-term care pharmacies or pharmacists that were in the consultant role. So it was a mix of results that we were getting from these people. These different pharmacists that responded found some different parts that were appealing to them. A lot of pharmacists in this job found that this role was very flexible. As you heard, pharmacists in this role can be working in a couple different settings. They may be in a long-term care pharmacy or in the consultant role. So depending what they're doing, they may have a lot more flexibility for their day-to-day. Also, pharmacists in this role found that they were using a lot of their clinical skills that they may have learned from pharmacy school and got to apply that into their day-to-day. An example here is a consultant pharmacist may have more access to data when they're looking to do different chart reviews, such as how well a patient's kidney function is working. This may be great because then they can actually look at the medications and make sure that these medications are dosed appropriately based on their kidney function. Because sometimes medications need to be dosed on how well a patient's kidney function is working. Another thing a pharmacist might be able to assess, especially in the consultant role if they've got access to the medical chart, is looking at what a patient's problem list or what their past medical history is. They may be able to then align what medications they're taking and identify do the medications they're taking match up with what their past medical history is? Because if they don't, they may need to talk with the healthcare team from the long-term care setting to decide what those medications are actually being used for then. Which then relates to pharmacists in these settings often are working with multidisciplinary teams. So often when they're working either in the long-term care pharmacy or even as consultant, they're needing to communicate with different nursing staff as well as the different providers who are providing care in the long-term care setting. One of the last things I wanted to talk today about related to long-term care pharmacists was, again, from this survey from these pharmacists in 2007. Besides looking at things that were appealing to the job, they noticed some things that might not be that appealing. Some things that they commented were the workload and hours in the setting might not be that appealing. But in healthcare in general, healthcare is a 24/7 thing. So people may be working days, nights, weekends, holidays, whatever it may be. But that was something that pharmacists in the setting found maybe is not the most appealing. Another thing that they found not very appealing is the paperwork. A lot of times, especially in the consultant role, there's a lot of paperwork that needs to be done or different charting because if a pharmacist is going through and reviewing different medications, they need to document that in the long-term care facility system, so that can be documented that a pharmacist actually came in and reviewed the different medications and had that review. And that was the presentation on long-term care pharmacy. Here are my references. Thank you.